Hello, this is Dr. Lewerenz at Longevity Health Institute in Rochester, Michigan, as well as us having an office in Madison Heights, Michigan, Lewerenz Medical Center. A patient I saw today actually was very, very interesting and made me think of something that I thought I could share with you, and maybe you could share with others, and really make an important health kind of discovery for somebody, maybe yourself or for a loved one. Obviously, our approach here is a restorative medical approach, and in restorative medicine and in personalized medicine, we look at root issues and root causes. Obviously, looking at systems and kind of unwinding and unraveling the little matrix of health issues that you might have. Always trying to restore health, but also focusing on prevention. So one thing that's really interesting and key is that as we age, of course, we get degenerative. Our joints start to get wear and tear because of sports and athletics and, falls and just lifestyle things that we've done for 10, 20, 30, 40 years. And these things can catch up. And of course, weight-bearing joints, where we get what we call axial loading on like hips and knees and spine and things like this, can actually become an issue. Where you get arthritis, you get pain. But truly what is arthritis is a term used for, means inflamed. It's an itis. You have inflammation in a joint. And you don't get pain when you have wear and tear. You get pain when you have inflammation. So if we can prevent or treat the inflammation, obviously then the pain gets better. So one thing that's really, really key here is that there are studies that show that even by your 30s, your spine has degenerative changes, your neck, your back, etc., because of just motion, movements, and wear and tear. But again, if we can get down to the root issues of why you're inflamed. Well, one very underappreciated thing that causes pain, that causes inflammation, okay, is infections. Now, I don't mean your infection like pneumonia or like you got a skin infection or you got strep throat or things like this. Those can lead to actually chronic bacterial, chronic viral infections. And why, again, I'm presenting this to you and kind of hoping you share this with others, that we can help and they can at least open their mind or possibilities of what might be causing pain in their body, is that infections actually can be harbored chronically from things that we pick up and or digestive issues that then harbor in our bloodstream and in our body and go to areas of susceptibility, which are damaged joints. Could be a hip, could be a knee, could be a shoulder, could be a spine, etc. This young lady I had this afternoon was 77 years old, came for kind of a health and wellness approach, and she had some arthritis and some sleep issues and things that we could help with. Her main thing though was pain in her spine, her lower back, and in her shoulder. And in one visit, just by approaching her with a functional approach, helping her gut health, removing some inflammatory known foods, and actually something that we discovered on her blood analysis that we looked under the microscope is she had a leaky gut and she had a lot of inflammatory things in her bloodstream, and I put her on an antiviral and put her on some things that would help her body be less inflamed. And in one visit, follow-up today, she actually said that she had 90% of pain relief in her shoulder and back that she hadn't had in years. So pretty profound, pretty impressive, but actually it's pretty common if you take this type of approach. So pain can be rooted to inflammation due to infection. There's other things that make us inflamed, like you've heard me probably discuss before, like things that cause low hormones, again, dietary issues. If you don't detoxify, inflammation due to stress and cortisol, which is a hormonal issue. But never forget the possibility that you might have pain due to an infection, whether it's viral, bacterial, or fungal. Hope this finds you well or helps you get better. This is Dr. Lewerenz at Longevity Health Institute.